A long line of cars queue up at a former vehicle emissions test centre on the outskirts of Chicago. This is now a drive-thru COVID-19 testing site operated by the Illinois National Guard. The site can process 250 tests a day, with the priority focused on first responders and medical staff.
Our first responders are a critical link in this crisis. We've got to keep them safe. We've got to keep them healthy. We've got to relieve the stress on them.
The queue of cars at this testing site continues for as far as the eye can see. It illustrates perhaps the level of concern amongst first responders and healthcare workers and their potential exposure to COVID-19. James Kruger is the Chief of Police at Oak Brook Police Department.
I think their biggest concern is whether or not they become exposed and potentially bringing it home to their family.
His officers are screened each day for symptoms, though there's no guarantee they're free of the virus.
All our officers their temperature is taken and recorded every day at the beginning of their shift to make sure that they're under a 100.4 threshold, and that way we know that they're at least asymptomatic at this point in order to continue to work.
Testing is increasing across the U.S., but health officials, including Chicago's Public Health Commissioner, Dr. Allison Arwoody, says it's not yet at the level it should be. But Arwoody is also quick to point out that not everyone should be tested.
I know that there have been a couple of these sites that have been set up for some of the testing with a priority towards first responders. If somebody does not have symptoms, they do not need a test, period.
The COVID-19 pandemic is putting a strain on first responders and medical workers, adding fear and anxiety to the already physically daunting challenge of treating an unprecedented wave of sick patients. Dan Williams, CGTN, Chicago.